Leicester Diocese is linked with our sister diocese in Kiteto, Tanzania. But where is it exactly? Well, here is East Africa. And zooming in is an area south of Kilimanjaro and Arusha and north of the capital, Dodoma. Zooming in further brings us to the regional centre of Kabaya, where the Diocese of Kiteto is based. And further still, zooming in brings us to the outskirts of town. And here is the eye clinic.
Here is Sister Sarah and her assistant Samueli when we visited, in front of the church's eye clinic, where she sees a lot of local people and does minor eye operations. Healthcare in Tanzania is a challenge. About 1 in 100 people in Africa are blind, and that's 4 times higher than in the UK, and much of it is easy and cheap to prevent. The church in Africa is often a provider of healthcare, and Kiteto is no different. There's been an eye clinic here with outreach to surrounding villages for a number of years, but the situation is becoming more urgent. Sister Sarah is past retirement age. They need her successor, but they also want more staff as there is so much unmet need in the area.
Here is Sister Sarah running an outreach clinic held in the church of a remote village called Kazi-Ngumu. An eye infection called trachoma that can affect all ages and cause blindness by painfully damaging the cornea is one of the commonest conditions they treat and work to prevent.
They want a Tanzanian doctor and nurse, and they will need somewhere to live. These are the houses they're building, and they're nearly complete. With a little more money and work, they'll be ready. Then they can recruit the new staff, build on Sister Sarah's good work, and develop it further.
Here are some of the kids in Kazi-Ngumu that the Kiteto Diocese is wanting to serve. Ever since the Apostles Peter, James and John met the Apostle Paul in Jerusalem and asked him to remember the poor, he was concerned for equality between Christians in different parts of the world. Many of us, fortunate enough to have retained our income under pandemic lockdown, have found ourselves spending less, and so have more. Now is an opportunity to practice the generosity that Paul encourages and to support our church family abroad in their mission to their local community.
Please help us to raise the £7,500 the diocese needs. This sounds a lot, but it will cover the wages for a local doctor and a nurse for the first year, after which the government should take over their salaries. It will help finish the staff accommodation and buy essential equipment. Please join us.